Do you feel pain on the outside of your elbow? When you lift something, or even hold a coffee cup? This might not be a simple strain. It could be tennis elbow. And no, you don't have to play tennis to get it. In this video, you will understand what it is, why it happens, and how to fix it. Tennis elbow, also called lateral epicondylitis, is actually not a true inflammation. It is a degenerative condition. The main problem happens in a tendon called ECRB, extensor carpi radialis brevis. This tendon helps extend your wrist and stabilize your grip. Over time, repetitive stress causes tiny micro tears, and the tendon begins to weaken. The most common cause is overuse, repeated wrist extension, and gripping. Common examples include using tools, typing, lifting, and especially tennis backhand movements. Risk increases with poor technique, heavy equipment, wrong grip size, and high repetitive load. Tennis elbow affects about 1 to 3% of adults. It is most common between ages 45 and 64. Men and women are affected equally. It often occurs in the dominant arm. And yes, even non-athletes are at risk. The main symptom is pain on the outer side of the elbow. This pain increases when you extend your wrist, you grip objects, or lift something. You may also notice weak grip strength, difficulty opening jars, pain while shaking hands. Diagnosis is mostly clinical. Doctors check for tenderness just outside the lateral epicondyle. They perform simple tests, like resisted wrist extension, or extending the middle finger against resistance. These movements reproduce the pain. Sometimes, other conditions can mimic this pain. For example, radial tunnel syndrome, nerve compression, or joint problems inside the elbow. That's why a careful examination is important. Imaging is usually not required. X-rays are often normal. MRI can show tendon changes, but it is not always necessary. Ultrasound, in experienced hands, can be very helpful. It can show tendon thickening and degeneration. Inside the tendon, we don't see classic inflammation. Instead, we see degeneration, disorganized collagen, increased blood vessels, and abnormal healing. This is why rest alone is not enough. Treatment is mostly non-surgical. First, activity modification, reduce repetitive stress. Second, pain control, ice and anti-inflammatory medication. Third, bracing. A simple strap can reduce tendon load. And most importantly, exercise, especially eccentric strengthening. This helps the tendon heal properly. Surgery is rarely needed, only considered if symptoms persist after long-term conservative treatment. The goal is simple: remove damaged tissue and stimulate healing. Tennis elbow is common, but treatable. Early recognition and correct management can prevent chronic pain. Take care of your movements, and don't forget to follow for more.